So I am thrilled and honored to have been one of the recipients of the Catalyst Award for a study that I am doing called Regenerate, which stands for Racial and Ethnic Equity in Genetic Education, Risk Assessment, and Testing. The study is important for various reasons. So to give a little bit of background, Black individuals in the United States have the highest incidence of pancreatic cancer. They also have higher mortality rates. In addition, when pancreatic cancer is diagnosed in Black populations, it's often diagnosed at stages that are more advanced and are less amenable to treatment. In terms of both Black and Latinx populations, they also have shorter survival times when diagnosed with pancreatic cancer compared to white populations, and more generally are less likely to actually be referred to genetic education, risk assessment, and testing. So from that perspective, it's really important to get a deeper understanding as to why these healthcare inequities are happening. So what the Regenerate study does is really take a step back and look at the perceptions to genetic education, risk assessment, and testing from Black and Latinx patients who have a relationship with pancreatic cancer in terms of having a diagnosis in the family or having a diagnosis themselves, and trying to figure out what can we do to make it easier to get genetic education and testing, what makes it more difficult on the patient level and also on the provider level, what can we do better, as well as what do we need to advocate for on the system level to make these changes happen. For me, as a first-generation Latina, it really is a project that is near and dear to my heart. I have seen firsthand the difficulties that my own family has had interacting with the healthcare system, and I want to learn, how can I make it easier for Black and Latinx patients who are at risk for pancreatic cancer to get cancer prevention and care, because we want to catch it before it actually happens. And that's why it's important to understand how I can actually increase this access and make certain that we're providing materials that bring Black and Latinx folks to get genetic education, genetic testing, and spread the word to make this more normalized. I think the other thing that PanCAN is doing really well is that when it comes to patient advocacy, pancreatic cancer is a really difficult diagnosis, and being able to find a community of people that have been through similar experiences can be really helpful when you are going through something like that yourself, or when you have a loved one who's going through a pancreatic cancer diagnosis.